Yes, welcome back to the program, and we thank Mohammed Arai there for the interview in the last half an hour. He will continue, inshallah, doing that throughout the week and trying to break through into the journalism world. But nonetheless, we continue with the regular programming now. And Dr. Ridwan Suleiman joins us. He's a senior researcher at the CSIR, has his degree in applied mathematics, a doctorate, in fact, and is busy tracking COVID-19 in terms of the stats and what's happening, putting it all into numerical format for us. Assalamu alaikum, doctor. Welcome to the program.
Walaikum salam. Thank you for having me, brother.
All right, let's start off with the importance of keeping this kind of statistical information ready. Where does the mathematics play a role?
So I do think it's very important to keep track of all of the COVID-19 data. I started tracking the specific numbers just because I found that the raw daily numbers that are reported every day don't quite tell the complete story. So one needs to have a look at how the number of confirmed cases, how the testing, how the number of deaths, etc., has been tracking over time. So you can get a full picture and a story of how the pandemic is spreading in the country, and also compare with how we're doing compared to other countries globally.
Mm-hmm. And what have you found? I mean, is there some glaring disparities between the trajectories in South Africa as compared to other places in the world, or are we following a similar path?
We've certainly following our own unique trajectory. South Africa, if you plot the COVID-19 confirmed cases, it doesn't look the same as any other specific country. There are a number of reasons for that. One, we had a very early and very strict lockdown, and you could see that our curve certainly slowed down, or at least the curve flattened significantly following the state of disaster regulations and the strict lockdown. So South Africa is unique in that sense with the early lockdown. But then on top of that, South Africa is also unique in the sense that we've been easing the lockdown regulations as the number of confirmed cases have still been on the rise. And I think most other countries implemented a later lockdown and then eased the regulations once that slowed down. But our trajectory has been unique, and our policies and regulations in that regard have also been quite different.
Have we managed to see, differences in the provinces in South Africa as different politicians and political principles have implemented the broad general lockdown regulations, and have we managed to pick up a different trend amongst the provinces?
Well, we're certainly seeing, and as expected, that the pandemic, or the epidemic is rather, it's spreading differently at different rates within the different provinces. I wouldn't put it all down to political policies and implementations, although that does play a part. I do think if you look, for example, the Western Cape was the epicenter of the virus a couple of months ago, or at least late May, early June. And it could be just that the COVID-19 seeded earlier in the Western Cape, and possibly due to more travel with people traveling from abroad. And earlier this month, we saw the recent surge in the most populous province, that being Gauteng, and we're seeing that the spread is Eastern Cape picked up soon after Western Cape, in fact, followed Western Cape's trajectory. And we're seeing now that KwaZulu-Natal following Gauteng's trajectory. It's just the nature of the virus that the epidemic spreads at different rates in the different provinces, and they each also have their own trajectories.
Help us understand, how does the doubling of the numbers happen? Why is it important to track that particular stat, and how is it calculated?
Sure. So the doubling rate is a measure to quantify the trajectories of the curves. We know that these are exponential curves, and how do we get a handle of that? And the doubling rate is a measure that basically tells us the number of days it takes for a specific measure to double, be it confirmed cases or deaths, etc. It's basically, as I said, just the number of days it takes for a quantity to double. In terms of the confirmed cases, of course, bearing in mind that that is limited by testing capacities and testing priorities, one can look at how those cases have been increasing over time. And if you look at the doubling rates of cases, you can see that nationally we're looking at it spreading every or doubling every 2 weeks, and it differs between the different provinces. Earlier this month, we saw Gauteng rising very rapidly with a doubling rate of around every 8 days. In other words, cases were tripling every 2 weeks. It has slowed down a little bit now to about doubling every 2 weeks. But if you look now, KwaZulu-Natal and Free State are doubling very quickly between every 8 to 10 days. So it helps us just to quantify the trajectories that we're on and to understand how fast or what the infection rate is nationally and in the different provinces.
One is the confirmed number of cases that the statistical data is obviously drawn upon. But is there any contingency in place for people who don't report their COVID status or who may have present with symptoms but are not going into for the official test? I mean, I've heard of families, for example, where one person has tested positive. The remainder of the family, 4 or 5 members, may have some symptoms or not, but are advised by doctors to simply just go through the isolation process and take some of the similar kinds of medications. They obviously don't then feature in those numbers. Is there, some kind of contingency for them, or is it just taken as is on the confirmed numbers?
In terms of the confirmed numbers, those are just those that have presented for testing and have confirmed. Of course, it's a good point. Not everyone presents for testing. We also have limited number of testing kits and test shortages within South Africa. So the number of confirmed cases is not a true representation of the actual number of people infected with COVID-19 in the country. It's difficult to fully quantify that. What one can keep track of is the number of tests that are being conducted over time. And you can look at a measure called the test positivity rate, which on a daily basis is the number of new confirmed cases as a percentage of the total tests. And that tells us whether the number of tests is keeping up with the number of cases, and it tells us whether we are detecting all of the cases. Lately, we're seeing that this test positivity rate has gone above 20%. In fact, it's averaging around 25%, which is very high. What it means is that for every 4 to 5 tests, for every 4 tests that we're conducting, we're finding a confirmed case, which confirms that there are a number of undetected cases in the country. And it's not possible to fully quantify that, but we do know that there are many undetected cases.
Finally, Dr. Ridwan, besides the role of quantifying the figures through the CSIR, what other information does the CSIR present to government in their fight against COVID-19?
The CSR is involved in a number of different projects in terms of COVID-19. I must state that I've been tracking these particular numbers in my own personal capacity, and I've been sharing them on my Twitter profile for anyone that's interested in seeing those. So this particular data and the numbers is all being done in my own personal capacity.
Dr. Ridwan Suleiman, Doctor of Applied Mathematics, also research at the CSIR and plotting in his personal capacity the data regarding COVID-19 infections and the disease. Thank you so much. Jazakallah khairan. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you. Wa alaikum salam.